Good morning, dear student. Today we are going to start a new topic. The name is Community Health and Sanitation. In community health, we will study about how to take care, how to make our society, our environment healthy. And next is the term is sanitation. It is meaning of cleanliness, right? Means what are the required measure for cleanliness? We will study here. Community health means to take care of health of entire population. Take care of health of entire population. It is the meaning of community health. It requires community actions. There are some few required actions are there. Such programs are undertaken by the government and social organizations. In such programs, involvement of people is essential. When people are not active, they need to be educate them in such programs in some particular way. Programs on community health vary in different parts in the country. It is all depend on the environment as well. This is because of different health programs. In infectious diseases are a big challenge to the community health program. Different infections are prevalent in different areas. So here we will just discuss about some programs. So community health programs. First is immunization. It is the most effective program on community health, right? It is immunization. It is the process. And what is immunization? So here there is a need to see what is the meaning of immunization. So it is a process in which a human body is made resistant to a particular disease. All right, it is done through a vaccine. In the same manner, here we are studying the COVID-19 vaccine. Okay, so this program has been very successful in controlling the spread of infectious diseases in the area where industrial waste is in the large quantity. Children often get affected with diseases like measles, mumps, diphtheria, and many other childhood diseases. In many countries, including India, such vaccination are provided free of cost. All right. If such infections are not controlled, it may grow into epidemic. Some of the infectious diseases have really been eradicated from the world. It has been achieved with the help of United Nations. A deadly disease, here actually we are discussing about smallpox. It is also a disease and it is a very deadly disease. A deadly disease, smallpox, was eradicated by 1979. This disease was resulting in 2 million deaths every year. Polio also been eradicated from many parts of the world. In India, its eradication is in the final stage, and other diseases like tetanus and whooping cough have been drastically controlled. This program needs a large amount of capital and worker, means the money is required. It takes years to control the spread of such diseases. Here the next program is the health clinic. Health clinic provide free medical service at reduced rate. Such clinic also provide free nursing service to the old people who need routine medical care and checkup. For poor people, it is the only source of medical aid. Each local level clinic keeps the record of diseases. This record is sent to the national and international community health office. People also get free medical guidance. This program also involve a lot of money and worker. Therefore, this program is mainly run by the government. Okay. The next is sanitation, cleanness. It is also a one program for health community. Proper sanitation prevents many diseases. It prevents It prevents many diseases. Mosquitoes spread the malaria disease, as we know it. It is a very common thing. It can be controlled by following sanitation instruction. So instructions are: standing water becomes the breeding place of mosquito, right? Diseases like hepatitis A is transmitted through food. All food must be properly washed and thoroughly cooked and properly cooked. Diarrhea is caused by contaminated water. In many countries, the community health program ensure that all restaurant and food processing plants are strictly following the sanitation guideline. Many diseases are caused by small bacteria and insects. They breed on the domestic and municipal waste. Community health program also ensure the timely removal of such wastes. Next point is coming, that is called population control. Many diseases are caused by population of air, water and land. Community health program ensure that drinking water is not contaminated by sewage. Many infectious diseases are waterborne. Okay, proper sewage proper sewage disposal is checked periodically. Air population sorry air Children, here I'm sorry, this is pollution control, not a population control, right? It is by mistake. So this is the pollution control. There's a need to control the pollution. All right. So this is pollution, not population. Okay. So air pollution level are checked. Special instruments have been devised to check the smoke exhausted by vehicle. All vehicles owner have to be get a to be get a pollution free certificate. Similarly, all industries also cannot emit smoke more than the prescribed limit. They also have to obtain the pollution free certificate. Okay, so the next point, that is, this is a medical research. It is another part of community health program. Doctors and scientists throughout the world are busy in laboratories. They keep on devising new technique and drug so that the disease can be controlled more effectively. Nowadays, efforts are on to treat disease like AIDS, cancer, Alzheimer, etc. And even we have reached to find out the vaccine of COVID-19 as well. It is also one result of after so many research we got this one. The next is a public education program. Also, we must have a program in which we give the education to the people. So many diseases can be controlled by educating the people. Okay, we must be educated. We must be aware about that disease. So community health program launch campaign like harmful effect of smoking, polio treatment, diet chart, etc. Such campaign can be noticed on banner, television, radio, a newspaper, etc. These programs make awareness among the people. And children, the next is coming. This is community health agencies. As already mentioned above, that all community health programs need lot of money and worker. Therefore, only big organization can take up such programs. At the international level, the community health is looked after by WHO, and here also we have heard this word WHO, this name a lot after so many in so many times, because during this pandemic which is going on, COVID-19. So WHO also in action a lot during this the whole time, and still it is in action. So at the international level, the community health is looked after by WHO, World Health Organization. This full form also everyone must be learn it. It is important, and it is an agency of UN, United Nation. It gets money from UN, and the latest research in the medical field is made public to all the nation at national level. There are agencies that are governed by national government. Some social organizations also contribute in the implementation of community health programs. One name is coming. You please everyone listen very carefully. This what I am going to explain. This is Red Cross is another international agency that renders medical help to the needy people afflicted with war, flood, earthquake, uh, and so many other natural disaster. Okay, and one another point is also important, that is health insurance. Sometimes you have heard there are so many insurance company which do insure make do the health insurance. Okay, so it is a scheme for people who want to avoid heavy bill in case of costly treatment. Many middle class peoples are opting this scheme to avoid financial hardship. Every year, an individual has to pay some amount to the company, to the insurance company. In some countries, this scheme is compulsory for the people. Class, this is a very good and a very knowledgeable topic. We have heard so many things which are important, and so many things which is going on around us as well due to this COVID-19. Okay, so as and still there is a need to uh, uh, take our precaution. Okay, from the coronavirus. So children, everyone take care of yourself. Okay, and now I'm going to end my video. Okay, goodbye class.